In this video, we're going to talk about capsular versus non-capsular patterns. So when you're looking at a joint and you see there's a certain restriction present, you're going to determine if that is a capsular restriction or non-capsular. Now, how do you determine that, right? So any joint that is controlled by muscle, which is most joint, can have a capsular pattern. Each joint has a different pattern of restriction if it's a capsular pattern. So for instance, for your ankle joint, for your talocrucial joint, if you see a restriction of more plantar flexion than dorsiflexion and it has a leathery end feel, that is said to be a capsular pattern of restriction. Capsular patterns of restrictions tends to be affecting the entire joint capsule, and it could be because of fibrosis, because of immobility, or just inflammation and infusion in the joint. Usually tends to be seen with arthritis, symptomatic arthritis, muscle spasms, osteophyte formations. So you're going to see a capsular restriction. Now, you can also have a non-capsular pattern, and non-capsular means it's any pattern of restriction that is not capsular. So if you see more limitation of dorsiflexion than plantar flexion, that could be indicative of a non-capsular pattern, which means there's something else besides the capsule that could be affecting that joint restriction. So it could be because one part of the joint is affected or obstructing the movement, or it could be because of some extra articular lesion that is obstructing the joint movement. So it could be there's a blockage in there because a loose body is like floating around in the knee, like the part of the meniscus is floating around, or it could be because of extra articular lesions. So it could be because of ligaments being adhered, a bursitis, MO. Any of these things could be a non-capsular pattern.